was a problem. That was not the case for the UK. We had and we still have a very clear plan. We had a containment phase and it was very successful. If you remember, we had planes coming in from Wuhan. We quarantined people under very strict quarantine regimes from high-risk areas. We followed up individual cases and families wherever that was possible. But once you end up with seeding and cases which we recognised across the community, our focus has to be, and I still think this is correct, on managing the clinical conditions of those individuals, and we have continued to do that. In an area where, in an ideal world, perhaps if you have endless resources, and I mean that in terms of people, I don't mean it in financial terms, but mechanisms for following through, testing, contact tracing and going on, it's an important approach to be considered. But I think what's interesting at the moment is the UK continues to be compared with Germany, and there has been a lot of comparison, and we will continue to do that. It's very, very important that we learn from other countries. But actually, German rates of disease are starting to rise now. We are still at different phases of this pandemic in different countries. And the important thing I always look for, or what I'm trained to look for, is to say, if I do this intervention, what is it that I think is going to happen? What evidence do I have that we would change a course or alter that? And I think we have rather ended up with a conversation which was a demanding on testing without necessarily seeing that causal link, the bit that says if we do lots of testing, how does this play out? There is an assumption there, and it's an important one for us to investigate. But I think the actual mechanism between the two is still not clear, and we must therefore, as you've indicated, continue to look at that. As our cases drop, if we have more digital mechanisms potentially, but again, fraught with difficulty, I think, in implementation, then there may be an opportunity to use testing in a different way to that we used during the containment period.
Tamara, I'm not sure if there's any follow-up on those two questions.
Can I ask you a quick follow-up on schools?
Of course you can.
Which is that you didn't say whether...
Broad context. We are in a stage in terms of dealing with this pandemic where there are an awful lot of questions that sadly people would love to have answers to, but in terms of how the virus develops, we have to see that. There are currently no plans to have schools open over the summer period, and we hadn't been working on plans to have them open over the summer period. But what we are looking at is different ways, such as I touched upon earlier, the Oak National Academy, of actually how we can provide resources for children right across the country, making sure that they can have the ability to catch up on their learning. Thank you ever so much, Tamara. If we can go to Hugo Guy at VI. Hugo.
Thank you. Secretary of State, are you looking at what's happening to schools in countries like Denmark, where they're trying things like staggering the school day, reducing class sizes to allow schools to reopen eventually, even if you can't put a timescale on that, but to do that with innovations that make them safer places? And can I ask Dr. Harries, you said just now that testing is not necessarily the reason why the UK has so many more coronavirus deaths than many other large countries. Do you know what the reason is then? Why do you think the UK has been so much worse hit than many other large countries?
So if I touch upon the point as to are we looking at other countries and learning from them, absolutely. And we're seeing a few examples of countries opening up their schooling system, and we'll look closely as to how that works, how that goes, and what lessons can be learned from it so we can benefit from that. Jenny.
Thank you. So I think just to step back about what I actually said, I don't think I quite said that testing and the deaths were directly linked. What I actually said was we have a difficulty in understanding the variation potentially between different countries and what steps are there to be clear what it is that may be causing variation in patterns across the country. Now, Germany stands out currently, but again, I think we need to be very clear, we need to look back in 12, 20 months' time on this. Germany currently stands out as different to other European countries, but in fact the UK is not sitting at the top of the European list, if you like, of deaths at the moment. It's really important we understand what this means. Counting deaths, I know it's a sad thing to talk about, and it's something which has had a lot of focus in the media recently. But actually, probably the most useful statistic going forward to compare between countries would be what we call an all-cause mortality. So it's actually looking to say, what is the difference between now, when we have had a pandemic, regardless of what the individual has died from, and what we have had in previous years at the same season, and with an age adjustment for that population. And all of those different things will vary between different countries. So it's very difficult to draw direct comparisons. It's not an excuse, it's a fact, it's an observation. And if we don't do it very carefully, we will go off into patterns of exploration which actually don't give us the answers that we need to manage either this pandemic or similar disease occurrences in the future.
Hugo, is there any follow-up questions that you may have?
Yeah, well, thanks for that, Dr. Harries. So just to clarify, are you suggesting that it will take a year, 2 years or more before any realistic, useful comparisons can be made between countries?
I'm not suggesting any useful ones. I mean, obviously, we do that on a daily basis. The very fact that we are talking here in this conversation about Germany as one example and many other countries as well indicates that we are all very alert to the fact that different countries may be experiencing slightly different rates. What I am saying, though, is we need to be very, very careful about our comparisons and take into account the age population in a different country. So Italy, for example, appears to have been extremely badly affected in terms of death rates, but there are very different family dynamics, for example, potentially more multi-generational units, potentially a higher proportion of the elderly, all sorts of different variables, both in population makeup and in the culture, and in how the health service manages, and in how public health interventions are implemented. So all of those need to be taken into account before we jump onto one side or another.
Thank you very much, Hugo. If we can go to Kate Devlin at The Independent.